This is a session on optic nerve and the brain disorders and the related uh, cranial nerve description, a little bit of them. So today we'll discuss this optic nerve and certain conditions that are related to the optic nerve. And those include, let me describe them and then we'll go through one by one. So we'll discuss the pathway and its route and lesions of the optic nerve. Then we'll discuss the optic disc and the neuroretinal rim in detail. We'll do the ophthalmoscopy, its features, its abnormal and normal findings in the ophthalmoscopy that we see. We'll discuss the optic disc swelling and the papilledema, pseudopapilledema, and pseudotumor cerebri. And then we'll discuss retinopathies, two retinopathies we'll discuss, diabetic and the hypertensive retinopathy. And then we will discuss uh, central retinal artery vein and arterial obstruction. And then we'll discuss uh, cherry red spot in that. So we have the name Jim in the end. That means that we can jump to any related topic that comes in our discussion. Like we'll discuss the cherry red spot, its causes, like it's a storage disease. The storage disease is causing the cherry red spot. And we'll also discuss the other conditions or drugs or toxins that cause cherry red spot. So everything will be in detail. And then we'll also discuss the lamina cribrosa, a little bit of discussion on pituitary gland and the pineal. Then we come to the main subject of the optic atrophy, optic neuropathy, optic neuritis, then pupillary light reflex, the normal reflex, and the abnormal reflex. And in the abnormal pupillary light reflex, we'll do Marcus-Gunn pupil, Argyll-Robertson pupil, and also we'll do in that the accommodation reflex and frontal eye field area 8 related to that. So we'll do like that, and then is that go? We'll do the blindness in detail and then visual scotomas. So visual scotomas will be our last topic. So to begin with the optic nerve, the first it is that it's a pure sensory cranial nerve. So what are the other sensory cranial nerves? Pure, that mnemonics is 128. Olfactory, number 2 is optic, and 1 and 8 is vestibulocochlear. So where is the origin? Where is the olfactory nerve? The origin of the olfactory nerve is outside the cranial cavity, in the nasal mucosa, in the superior concha. Its fibers, the nerve fibers, they pass through, see here, through what? See these small holes in that. The cribriform plate, the cribriform plate of which bone? Cribriform plate of the ethmoid bone. So all these are important from exam point of view, that they begin in the upper nose, then they pass through the cribriform plate of the ethmoid bone, they form the optic bulb and optic tract. Then we have this, I just told you. Then it enters the cranial cavity in the anterior cranial fossa. And where optic nerve enters the cranial fossa, it enters in the middle cranial fossa. Then the cranial nerve 8, vestibulocochlear, has bipolar neurons, two parts, cochlear, where it is concerned with audition, auditory function, and it starts in the inner ear cochlea to the brain. And there are three tests for that: Frayney's, Weber's, and Schaubeck. And then it is also done with the audiometry. The galvanic is tested with the galvanic vestibular stimulation or nerve stimulation, vestibular nerve stimulation. MRI demonstrated diffuse axonal injuries due to neural shearing. So this is audiometry. So these are the three sensory cranial nerves. Now what about the motor nerve? It's already zoomed, Manish. Hello, thank you for joining. And it's on the, what is that called? Screen layout. Okay, let me see. This is cinema layout now. Is that bigger? Is that okay for you, Manish? Uh, okay, so we discuss. I have to go back on the YouTube on the StreamYard screen, so it takes a while when you send me a message to get that message. I'll give you a link so that you can talk with me. Uh, Let me finish this cranial nerves, different types, and then I'll give you the StreamYard link so that we have a direct communication. So the pure motor nerves are 3, 4, 6, 11, and 12. The third cranial nerve, the oculomotor nerve, supplies the extraocular muscle, intraocular muscles, and the other muscles. It does not supply, it supplies all the extraocular muscles except superior oblique and lateral rectus. And then it supplies the intraocular muscles. Which intraocular muscles? Pupillary constrictors and the ciliary muscles. So it supplies the pupillary constrictor muscles. What about the pupillary dilator muscle? Which nerve supplies the pupillary dilators? Pupillary dilators are supplied by it. You send some message. It's A Alt F4. Oh, you want me to zoom it in? Okay, let me see if I can. What is it, right? Alt. No, I know I can look at this. View, zoom in. Is that okay? Let me zoom in more. But that one disappears. That's okay. We'll see that. We'll do. This is okay. See, it gets. It disappeared. It disappeared. Let me go back. I don't know. Oh, whole file disappeared. Let me go back. Okay. See, it's gone. Zoom out. It interrupts things. That's fine. It's the maximum we can do. I tried to do that too, as you wrote F4, but this one didn't work. Everything disappeared. Anyway, so the pupillary dilators. Which muscle supply the pupillary dilators? It's a superior cervical sympathetic ganglia. They supply the superior pupillary dilator. They dilate the pupil in the conditions of fear and fright, the sympathetic function. And the next muscle is ciliary muscle it supplies. So what happens when ciliary muscle contracts? When ciliary muscle contracts, it relaxes the suspensory ligament of the lens. So the lens becomes more convex to converge light. So that's a ciliary muscle there. So it supplies the intraocular and the extraocular muscles. Then which other muscle does cranial nerve 3? Oculomotor supplies. The oculomotor supplies the levator palpebrae superioris in the upper eyelid. So its function is to lift the upper lid up. So if this is paralyzed, if levator palpebrae superioris is paralyzed, then it causes ptosis. It's one of the causes of ptosis. There is another muscle that causes ptosis if that nerve is paralyzed, and that occurs in Horner syndrome. Horner syndrome, fibers from hypothalamus come down, and that is a very small muscle. I don't recall the name of that muscle, but anyway, in the Horner syndrome, where there is ipsilateral ptosis and hydrosis, so that's because of that muscle paralysis. Then we come to the fourth cranial nerve, the trochlear nerve. That's the smallest cranial nerve, trochlear, that is on the base of the brain. And the third and the fourth cranial nerve, they arise in the midbrain, right? So olfactory from nasal mucosa, optic from behind the eye from the retina, then the third nerve from midbrain, fourth nerve trochlear, smallest, and it supplies this superior oblique muscle. Then the sixth nerve, abducens, supplies the lateral rectus muscle. Paralysis causes lateral gaze palsy. Then the 11th nerve, the accessory nerve, two parts. One is arising from the spinal cord and one from the brain. 11th, the cranial nerve, 8th onwards, then they arise from the medulla. So this one, spinal and the brain parts. Two muscles it supplies. Which two muscle does the accessory supplies? It supplies uh, sternocleidomastoid and trapezius. Sternocleidomastoid is shrugs the shoulder, and the sternocleidomastoid is a muscle you can check with turning the head to the opposite side. And if you turn the head to the left side, you can feel a prominent muscle tense from in the neck, in the front of the neck, that goes from the manubrium sterni to the mastoid process. It's very easy to see. Then we have the 12th cranial nerve, that is hypoglossal. Which muscle does it supply? The pure motor nerve that supplies the muscles of the tongue. All muscles of the tongue? No, except hypoglossal. Oh, sorry, palatoglossus. The palatoglossus is supplied by the I think it's palatoglossus is supplied by a branch of the vagus nerve. Okay. Then we move on to the we move on to so we're done with these cranial nerves. Then we do the mixed nerves. Okay, and then all this 5, 7, 9, and 10. Mixed nerve, trigeminal. Trigeminal motor sensory nuclei. It's, it supplies the front of the face. Front of the face through 3 sensory nerves. Its sensory nucleus has a swelling in it just after its origin, and that's called Gazerian ganglion. Then it divides into 3 sensory nerves, that is maxillary, mandibular, and ophthalmic is the first, which supply the forehead up to the vertex. The the ophthalmic supplies from the upper eyelid to the forehead. Maxillary In general, I'm just telling, a maxillary from lower eyelid to upper lip, and mandibular from the below the lower lip. So this is the trigeminal, sensory, and motor. Which muscles does this supplies? The motor. It supplies the muscles of mastication. And what are the muscles of mastication? They are masseter, temporalis, lateral, and medial pterygoid. And the other muscle that it supplies are tensor tympani, tensor villi palatini, omohyoid, and anterior belly of the digastric. So the anterior belly of the digastric is supplied by the mandibular division of the trigeminal nerve. And what about the posterior belly of the digastric? The posterior belly of the digastric is supplied by the facial nerve. Okay. And then we go to the facial nerve.